Well, good evening, and thank you for joining us for Retired Racehorse Project's Virtual Makeover Week. This is our educational session on dealing with gastric ulcers in your thoroughbreds. I'm Alex Beckstett. I'm the managing editor of the Horse Media Group, home to thehorse.com and The Horse, Your Guide to Equine Healthcare. We also publish Off Track Thoroughbred for the Retired Racehorse Project. And I'd just like to thank Triple Crown for sponsoring tonight's event and to let you guys know that we will be drawing names from the list of registered attendees at the end of this session to receive a free subscription to Off Track Thoroughbreds. So stick around to see if you are one of those lucky people. So tonight we're discussing gastric ulcers, a condition that's incredibly prevalent in our horse population, particularly among racehorses and sport horses and thoroughbreds in general. Our experts tonight are Dr. Frank Andrews, Dr. Rana Bozorgmanesh, and Dr. Bill Vandergrift. Welcome, everyone.
Thank you.
Thank you.
Just to give you a little bit of background, Dr. Frank Andrews received his veterinary degree from Washington State University and completed an equine internal medicine residency at The Ohio State University. After 20 years at the University of Tennessee College of Veterinary Medicine, he is currently the interim department head of veterinary clinical sciences, LVMA equine committee professor, and director of the equine health studies program at Louisiana State University School of Veterinary Medicine. Dr. Andrews is board certified in large animal internal medicine, and he has clinical and research interests in equine gastrointestinal disease, endocrine and respiratory disease, and he has been doing scientific investigation for more than 30 years. Dr. Rana Bozorgmanesh studied veterinary medicine at the Royal Veterinary College in London, then went on to spend 4 thoroughbred breeding seasons traveling the UK, Australia, and the Middle East. She completed an internal medicine fellowship at Hagyard Equine Medical Institute, followed by a large animal internal medicine residency at UC Davis, staying there as associate veterinarian in the equine internal medicine department before returning to Hagyard as a specialist in equine internal medicine in 2016. And Dr. Bill Vandergrift has helped horses around the world in all disciplines stay healthy and perform to the best of their ability for nearly 40 years. He formulates all Triple Crown feed products and has provided technical support for Triple Crown nutrition for nearly 30 years. Through his independent consulting efforts, Dr. Vandergrift has developed a line of nutritional supplements and nutraceuticals that have helped horses regain health and quality of life and help performance horses reach the top of their game. He uses a whole horse approach when advising clients on how to best support their horse's well-being and performance. And so to begin, I'd like to review some basic information about gastric ulcers, and then we will move into our Q&A, but feel free, attendees at any time, to put questions in the Q&A chat in Zoom, or if you're watching via Facebook, in the comment section of Facebook Live. So let's start with you, Dr. Andrews. Can you give us a brief rundown of what exactly gastric ulcers are and maybe the different types?
Okay, yes, sure, Alexandria. So gastric ulcer disease in horses is really multifactorial. In other words, it affects, well, first of all, let's back up. The anatomy of the horse, the stomach is somewhat unique in that it has a non-glandular portion, which is really an extension of the esophagus, extending down into the proximal third of the stomach, or the first part of the stomach. And then the last 2/3 of the stomach is a glandular portion, which is similar to what we have. And so ulcerations in the horse occur in the non-glandular mucosa probably most frequently, at least that's what we used to think. And they're really wounds, usually caused by acid secretion, maybe lack of feeding, reflux of acid into that tender mucosa. They have very little ability to resist acid injury. And so these are really wounds associated with acid secretion. And it's likely associated with some other, hydrochloric acid as a primary culprit, but also volatile fatty acids, which are really fermentation products of really high grain diets. And that's why we recommend, when you're feeding your horses, to minimize the sugary grains and feed grains that maybe have lower sugar content, because there are bacteria in the stomach and they ferment these high sugars, high sugar content, and then they produce these volatile fatty acids, which are things like acetic acid, butyric, propionic, and valeric acid. And they act synergistically with hydrochloric acid to really damage that what we call the non-glandular or squamous mucosa. So these are called equine squamous ulcer disease or equine or squamous ulcer disease. And then we have the glandular mucosa, which we used to think was pretty resistant to ulceration, but now we're finding out that, especially in our warm bloods, the larger horses, the draft breeds, they tend to have, again, wounds in this glandular portion of the stomach. And we think that's really associated with a lack of, or perhaps damage to the protective mechanisms in that portion of the stomach. And that would be, and when we feed horses non-steroidal anti-inflammatory drugs, it kind of breaks down the mucus barrier and the bicarbonate barrier that protects the stomach, and then there's ulcerations that occur. But we don't know, these are not the typical ulcerations that we see in people. They don't have this cavity, borders around it that we see in typical ulcers in people. And they're more of a raised inflammatory type lesion. So we're still learning a lot more about these glandular ulcers. But we feel that there is pain associated with ulcers in this glandular region as well as in the non-glandular region. And they can lead to really sort of mild clinical signs in some horses and severe clinical signs in others. That's kind of gives you a little bit of a basic understanding. We call this syndrome equine gastric ulcer syndrome, and it does involve ulcers of the non-glandular, glandular stomach, as well as the esophagus and the duodenum as well. We do see ulcers in both of those regions. And we can liken it to gastroesophageal reflux disease, which is reflux of acid in people up into the tender esophagus. And so since the horse has esophagus present in the stomach, there is this constant reflux, especially in horses that aren't that haven't been fed. Maybe they have been fasted overnight and then they compete during competition.
Thank you for that, Dr. Andrews. So you kind of started to get into the role of diet and nutrition, but I want to ask Dr. Vandergrift to maybe elaborate on that a bit more, the role that diet plays in gastric ulcer development and even prevention.
Okay. Well, thank you, Alex. And as Frank alluded to, do you want that in 30 seconds or less? I can't do it. But because it is a multifaceted component, and Dr. Andrews and I have been on the same page on this, I think, for a while. In that if I'm dealing with a horse that we feel is predisposed to gastric ulcers or does in fact have a history or currently has gastric ulcers, we do try to reduce the soluble carbohydrate or the starches and the sugars component of the diet as much as possible. We try to, as much as practical, increase the frequency of feeding. I'm a real believer in basically having forage in front of the horse 24/7. But in terms of if, feeding any meals, try to feed those as often as possible, taking into account, obviously, that, I sometimes deal with clients that tell me that they can only feed once a day and that's the best they can do. So, and then I have other clients that are feeding 6 times a day. And so, hats off to them. But we all have to be practical in how we address that, but understanding that, the horse evolved as a constant grazer. He's He's designed to eat small amounts on a very regular and frequent basis. And when we take horses and we stick them in a stall or stick them in a paddock and we try to turn them into meal eaters, we've immediately gotten away from the way their whole system is designed to consume feed. And oftentimes people don't pick up on the fact that that in itself is one of those stress factors that comes into play. And, you know, I think this is one thing that we all allude to is if you've got one minor stress factor, many horses can handle that without any problem. But you can take many small stress factors that then build upon each other, whether it's a nutritional stress or a mental stress, physical stress, etc. And sooner or later, you've got a high enough stress level that that's affecting the entire physiology and function of the gastrointestinal tract. So right away, I'm kind of getting away a little bit from the nutritional aspect. So just to kind of reel myself back in, good quality forage, as often as much as possible. Pasture grass, excellent when that is available. And obviously, you know, people get scared sometimes with pasture grass because they're worried about the soluble sugar content in the grass and all the effects that can have. So depending upon where you're located and the quality of grass that you have, obviously, then you have to take that into consideration. But trying to have forage in front of these horses as often and as much as possible so that they can eat as much of that as they want. Now, many times these thoroughbred race horses, due to their energy requirements, very rarely, if ever, can meet their energy requirements on a 100% forage diet. So that then means we have to use some type of supplemental energy, and energy is the number one problem or the nutrient that is hardest to meet for a racehorse. By the time you meet their energy requirements, 99% of the time their protein requirements are met. So getting enough energy, getting enough calories into these racehorses is really the name of the game. And a lot of people think that they've got to use, you know, high starch grains and high fat grains in order to get, you know, the right amount of energy into them. And that's not necessarily true. If the digestive system is working the way it's supposed to, you can use a low starch or a low soluble carbohydrate feed, a higher fiber, higher fat type feed, meet the energy requirements, and that's going to reduce the predisposition to gastric upsets. And I'll just throw out that there have been horses that have actually won the Breeders' Cup, so the upper level competition level, on very low starch feeds. So it can be done. And I guess one other thing that I run into that I want to mention is that, you know, we all know that thoroughbreds at the track tend to have a higher incidence of gastric ulcers than a lot of other classes of horses. And one of the reasons for that is the stress level that they're under, whether it's the, you know, physical stress, the mental stress, the dietary stress. And due to that stress, oftentimes these horses reduce their appetite. And because what's one of the things we always hear about a horse, or we like to hear about a horse after he runs a race? Well, he cleaned up, you know, he ate what we offered him. So appetite is a very important thing that's constantly monitored in these race horses. And when horses or race horses start to back off their feed, so their appetite reduces, oftentimes one of the first things people do is, instead of trying to improve the forage intake, they start feeding more grain, because as the horse reduces appetite, he loses weight, and so they feed more grain. And won't get into a whole big deal, but I actually ran into a situation several years ago where somebody would just put a heavy grain feed in front of a racehorse, free choice, in an effort just to try to get this horse to eat something. And before he realized what had happened, this horse was consuming 25 pounds of a heavy starch grain feed. And when I asked how much hay the horse ate, he says, well, I give him all he wants. I said, that's good, but how much does he actually want? And he says, well, you know what? He doesn't really touch it. So that's how you can kind of get into these anomalies. And that, that's a recipe for, gastric ulcers, as well as a lot of other gastrointestinal issues. So I'm going to wrap it up and let you ask the next question before I keep going. Okay.
Thank you, Bill. We've got some questions coming in from our live audience. I'll give this one to you, Dr. Bozorgmanesh. What are the indicators for hindgut ulcers? How do you diagnose them? And what is your recommended treatment? That's a lot to cover. So if anybody else wants to chime in when you're done, feel free to hand the mic off.
Yeah, I'll definitely get some other opinions on this. Hindgut ulcers, in my experience, they're pretty difficult to diagnose. Clinical signs can be non-specific. Unfortunately, the region of the hindgut is not easily accessible by endoscopic evaluation. And really, the only imaging modality we have for the area is transabdominal ultrasound. And so in some types or in certain severity of hindgut ulceration, for example, right dorsal colitis, you may be able to visualize thickening or edema of that region of the right dorsal colon. Although the sensitivity of that is probably not that great. Some of these horses, again, depending on the severity of the condition, can have low proteins when you measure protein levels and check their blood work. And as far as clinical signs go, again, non-specific, can be mild colic, grumbling colic off and on. They don't necessarily have diarrhea. Some of them can have slightly looser stool. Beyond that, I don't think there's anything necessarily obvious. As far as treatment goes, generally I will reach for misoprostol and sucralfate for these cases, and sometimes we'll treat with metrazole as well, which is Gastrigard. The misoprostol improves blood flow to that area of the colon and tends to kind of aid in healing quite substantially. And the sucralfate kind of acts as almost like a Band-Aid for the area. And yeah, I think generally a couple of weeks of treatment to longer, even longer, maybe a month or two sometimes is what's required. You can also make some diet modifications and kind of decrease forage to decrease kind of long stem forage to decrease the workload on the colon as well in severe cases. I don't know if either of the others have any other opinions on that.
I think
go ahead, Frank.
Yeah, go ahead. Yeah, so yeah, I would second that. Is we try to decrease the bulk in the diet, and this is where if you have a horse that has that kind of intermittent diarrhea and low proteins, maybe the horse has been stressed, been traveling to a lot of shows, has maybe a little bit dehydrated. When horses travel, they don't tend to drink as much. Different water sources at these shows. And so the stress of being, and maybe they're on non-steroidal anti-inflammatories because of some pain. But there's a lot of horses that have these hindgut ulcers that are not on any non-steroidals. But certainly stress and dehydration can cause that. So you want to be sure that they're, they have good water sources and things like that. So, but we reduce the bulk in the diet. So we start them on a pelleted diet, something like an equine senior that has basically a forage background, an alfalfa background in the pellet, so that it's about 20 or to 30% fiber. But a lot of clients don't like to have their horse just on a pelleted diet. But that's essential, I think, to decrease that workload in the colon And the horses are sicker, I think, with the right dorsal colitis because they tend to lose protein, they tend to not feel as good, and they tend to have this intermittent diarrhea. And I do like to use Gastriguard, you know, the omeprazole products. And the reason why I use that is because a lot of these horses are stressed and they will have gastric ulcers as well. And so a lot of times scope the stomach, have a look. We can't really scope the colon because the colon's too far down, and you can't do a proctoscopy either. You can't because that's way up. So so you're basically relying on ultrasound, and then if they do have gastric ulcer, we do start them on omeprazole. And you have to remember that the stomach you can have primary ulcers, which are, you know, just from the disease, acid disease, or you can have secondary ulcers from stress from some disease further on down the colon. I look at the stomach as the window on the rest of the GI tract. And if there's disease further on down the GI tract, then the stomach may manifest that in ulcers. And so I always look at the stomach first and see if there's ulcers, treat those, and then modify the diet to treat the hind gut ulcers. And that's kind of dietary things are very important, I think. One thing I would caution the use of misoprostol is in a pregnant mare. So we have had that happen. People will go, oh yeah, we'll put them on misoprostol, but they forgot to ask that question, is the mare pregnant? Because it will induce an abortion. And we've had that happen, not me personally, but in practitioners in the area. So misoprostol is a synthetic prostaglandin, and it's used to basically for follicular activity, and then but it could cause an abortion. So, Bill, you
yeah,
comments too.
Yeah, again, all three of us are in agreement. When I'm dealing with a horse from a nutritional standpoint that has got, you know, diarrhea, intermittent diarrhea, I will also recommend, you know, hay pellets instead of long stem forage. But anytime, you know, that we've got diarrhea, we've also got dysbiosis. And so this is probably, as a nutritionist, I may pay a little bit more attention to this aspect of it. And we don't necessarily, I mean, I do like to use, you know, some probiotics, but I think too much emphasis is placed on probiotics or the actual bacteria themselves. And many times I think everybody out here forgets that the vast majority of the innate bacteria, whether it's in the small intestine or the large intestine, are anaerobic. And being anaerobic, you can't make a probiotic out of them. Okay, they won't exist, or they can't survive outside the horse. So the question then is, how do we reestablish a healthy microbiome if the majority of those bacteria that we want are in fact anaerobic? And the most effective way to do that, and this is also being utilized in human medicine as well, is to utilize prebiotics, which are essentially specialized sugars. Now, not the same type of sugar that we talked about earlier, you know, about that we're trying to reduce the soluble sugars and carbs in the grains, but most prebiotics are going to be some type of saccharide component that is going to stimulate and support the growth of the innate bacteria. And if you've got dysbiosis, you're going to have, and I'm going to throw out a term that nobody's mentioned yet, but it's one of those things, diseases of the month, you know, and that's leaky gut. But depending upon how you define leaky gut for discussion purposes, let's just say that you do have some inflammation of the intestinal mucosa. And anytime you've got inflammation of the mucosa, you're going to affect the microbiome. Anytime you reduce the complexity of the microbiome, oftentimes that results in intestinal inflammation. So yes, sacriophate and so forth, can help reduce all that and help the microbiome reestablish itself. And, using, that combined approach, we can help a lot of horses. And, I will say that any time that I get approached, with a case like that, one of my first questions is, what does your attending veterinarian have to say about it? Because oftentimes these horses have to be treated, with some pharmaceutical agents, and therefore, the veterinarian has to be involved in these. If you're just going to try to do it on some herbal supplements that you buy off the internet, oftentimes you're going to fail. So it's a very complex situation, and it takes a combined approach. So.
Thank you. And we have another audience question I'm going to throw out there and see if any of you guys are familiar or have ever seen gastric ulcers tied to choke.
So yeah, you'd have to qualify that a little bit. So are they asking, is the chicken or the egg, the choke occur first or the ulcers occur first? I think that there's probably not an association with gastric ulcers. Rana may have some, but I've not seen gastric ulcers result in choke. Certainly the stress of having some kind of stricture in the esophagus or an ulceration in the esophagus could lead to gastric ulcers just from the stress of the choke, a reoccurring choke, or issues like that. So usually chokes are, depending on if they're, what the cause is, can be an acute episode and resolve fairly quickly. But if you have these horses that have chronic choking or they eat fast, then you could certainly see gastric ulcers along with that due to the stress. Rana, do you have any comments on that?
No, I mean, I agree. I think in my experience, I guess the only other thing I would mention is in some of these horses that have choked, if we're restricting their feed intake or their hay intake following the choke, to prevent or allow the esophagus to heal and prevent further choke episodes in that short-term period, we usually will treat those with ulcer prophylaxis to prevent them from getting ulcers, because they are going to be at risk of that because they're not getting a normal quantity of the hay forage that they need.
And then we have another question come in from our audience. One of our attendees has an OTTB with a history of ulcers that cribs, especially around mealtime. So is there a relationship between cribbing and ulcers?
So there have been, there's at least one paper out there, probably more than one, that has, attempted to make an association between cribbing, crib biting, and gastric ulcers. In that paper, I believe they said that because the horse had ulcers, they were more likely to crib. And then once you treat the ulcers with the omeprazole or other anti-ulcer medications, the crib biting goes away. I think that's that particular paper didn't have any controls, and I think so. I'm not a firm believer in that that crib biting and ulcers are associated. I think that whenever a horse has stall vices, stall weaving, crib biting, things like that, there is a propensity to have air in the stomach, to have a stress level when the horse is in stall. And so all that stress could certainly lead to gastric ulcers. So again, it's the chicken or the egg. But there are horses that even out in pasture will crib on everything that they can find, wooden fences, things like that, tear down the fences really. But there's probably some stress involved there. But I guess I'm I have a difficult time saying that, yeah, you just treat the ulcers and then the crib biting goes away. So we've scoped so many horses that are crib biting, have stall vices, but their stomachs are very clean. You know, you can't really, you can treat them certainly, but the crib biting doesn't go away. So there must be certainly some stress involved in that.
And then I had a question come in from one of our former Thoroughbred makeover trainers saying that you always hear about a horse's lifestyle and management contributing to their incidence of gastric ulcers, but does poor or stressful training contribute as well? He said, let's say you treat a horse for ulcers and correct his lifestyle and diet and management, but you keep training him in a stressful way. Is this horse still predisposed to getting ulcers?
Who wants to take that?
Well, yeah, and Ron, I bet you guys can chime in as well. But yeah, I think you know, heavy training is certainly a predisposition, a risk factor for gastric ulcers. You know, that's I had a client once who's a rodeo cowboy, and he brought his horse in, probably some of the worst ulcers I'd seen. And the horse was not on any non-steroidals, but it was a heavy travel schedule, heavy rodeo schedule. I said, well, just, you know, take your horse out of training, you know, let it go in the pasture for several months. And his comment was that this is my sole source of income. So in those horses, and having worked with the Budweiser Clydesdales, which are on the road a lot, you know, and under, you wouldn't think they would be under much stress, but they're tacked a couple times a day and they pull the wagons and things like that. There are going to be a few horses that have to be on heavy training, that you're going to have to continue to treat with pharmacologic agents like omeprazole. And it's just a fact of life. There are those high stress horses that are going, when they're in heavy training, they're going to have gastric ulcers, and you have to, you know, just treat them and, you know, get them on some kind of preventative, and then help, you know, make sure that the diet is adequate, good forage, and plenty of good water and things like that. And, you know, and maybe a prebiotic, and kind of help them kind of weather the storm. But it's, you know, the heavy training certainly does contribute to ulcers in our horses. And when they have to do that, you know, you have to treat them pharmacologically.
And just like people, you know, some horses are going to be more predisposed to developing ulcers than others, even under the same, you know, training regimes and travel and so forth. And I think it's very important that people kind of train themselves and learn how to assess the anxiety level or the stress level of their different horses. And I'm sure that, you know, everybody can relate to the fact that, you know, somebody may present a horse to you, and you take one look at the horse and you can tell that this is not a happy camper. But the person that brought the horse into you doesn't have a clue. You know, they think the horse is fine. And so, you know, as horse owners and managers and trainers, you know, I think it behooves us all to, you know, fine tune our skills at being able to read, you know, our horse's body language and all the signals that they try to give us, you know, that basically says, you know, hey, I'm not having a real good hair day here. And that can really help you out. So.
Well, Bill.
Rana, you probably look at most of the heavy duty thoroughbreds that are in heavy training there in Lexington. What's your idea on that? Do you see some horses that you can't really fix?
Yeah, I mean, I think certainly the intensity of training and style of training can contribute. There are some trainers that, are able to provide turnout for their horses, or they'll race them and then they go and will get, a couple weeks of being stalled with some turnout at a farm, and then they go back. I think that's really beneficial for them. And then there's, a lot more intense training where they're traveling, between tracks, etc. And I think those horses definitely suffer from more or worse ulcers. I mean, there's a really, really high prevalence of ulcers in racehorses in general. And I think it can be difficult to kind of differentiate training and which ones have it and which ones don't, because so many of them do. But I do think if they're able to get some turnout between races and some pasture grazing, I think they do benefit from that.
Right, and you don't want to play country music in the shed row.
Right, exactly. Classical.
They did.
Classical.
They did a study in Australia. They looked at risk factors, and one of them was playing country music in the shed row. They had more horses with ulcers. So the risk factor is country music in the shed row. So don't be playing the country music. Play maybe something more positive, maybe.
I have another question that's come in. What supplements do you recommend for ongoing prevention of ulcers, and what are your opinions on adding aloe vera? Bill, you might have some insight on this, and Frank, I don't know if this is something that you've studied as well.
Yeah, I can start, but Alex, you're right on. I know Dr. Andrews has looked at a lot of various, nutraceuticals and whatnot. The reason I guess I'd like to start this one, Dr. Andrews, is that I think this topic needs to be underlined a little bit, in that the supplements and the nutraceuticals that are available, whether they're part of, there's some feed companies now that include these feeds. There's, lots and lots of various supplements out there, nutraceuticals, and a lot of them actually claim, to cure ulcers, etc. From a nutritional standpoint, I think what we're trying to achieve is to hopefully reduce the chances of the horse developing severe ulcers. But the whole development of ulcers is more of a, it's a physiological / pharmacological change within, the stomach and the intestinal system. And yes, some of these nutraceuticals can reduce the incidence / severity. But if you've actually got a horse that is presenting with ulcers, has had a history of ulcers, then I think you've got to get people like our other two panelists here involved and actually work with some pharmacological agents such as omeprazole, misoprostol, cyclophosphate, etc., to actually treat those ulcers. So yes, there's some nutraceuticals that can help, but if you're actually trying to treat ulcers, then treat them and don't play around with a lot of the nutraceuticals. You mentioned aloe vera. First of all, make sure when you're sourcing aloe vera that it's a full strength deal and not something that's diluted out, because there's a lot of aloe vera products out there that have just a little bit of aloe vera in them. And I think there is some evidence to suggest that aloe vera can improve, the health of, the lining of the stomach. And I'll let Dr. Andrews talk on that one a little bit more. But there again, if you've got a horse with gastric ulcers, I do not believe aloe vera is going to cure them. So you have to keep that in mind. So Dr. Andrews, you want to add to that?
So yeah, so we've done quite a bit of work with a variety of different supplements. But in the studies that we do, we obviously treat the ulcers first with the omeprazole, and we usually use a 2-week. So we pull these horses out of the pasture, and then they have ulcers. We have about 60 rescued thoroughbreds that are part of our Equine Health Studies program, HERD, and we use those to help us understand a little bit more about gastric ulcer disease. When we pull them out of the pasture and they have ulcers, we treat them for 2 weeks with omeprazole, and then at the same time we put them on a variety. We put them on a variety of different supplements, we started with a product called sea buckthorn berries pulp and juice. It's a berry that has high antioxidant content. It grows in Tibet and greater than 10,000 feet. It's blessed by the Dalai Lama, so it really must be good. But it's one of those things where you're going to use it as a treatment. It's a supplement that can be used along with omeprazole and then continued on after that. It was effective against preventing glandular ulcers in our thoroughbreds there at LSU. So we do feel that that's helpful in maintaining stomach health. The other products, Smart Pack, Smart Gut Ultra, did show some prevention of reoccurrence of ulcers after withdrawing from omeprazole. So that type of thing, that supplement, it has the sea buckthorn berries, it has pectin and lecithin in it, which we feel as a coating agent. It also has aloe vera juice in the pellet as well. So we think that that has some effect. It also has some buffering agents as well. And we did do some of the work on the Purina product Outlast, which is basically a marine calcium product. It's a slow releasing calcium supplement that buffers stomach contents. It's a very effective buffer. And there's several feed companies that have come out with other buffering agents. I'm most familiar with the Outlast product. In fact, the publication, it was just published in Journal of Equine Veterinary Science, the study that we did at LSU for Purina. And then it was very effective in the Budweiser Clydesdales as well. So we used that to help them maintain stomach health while they're, when they're traveling around. So those products I think are helpful, but I would second Bill's comments that, if we find ulcers, we treat them with pharmacologic agents and then use these supplements that have some data with them. And I would encourage people to, not just look at somebody's comments on the supplements, is try to look at supplements that have some research data from, and maybe publications as well, that can guide you into, how you can use these supplements to the best of their ability for the horse. But basically, and it takes a long time. We finished a study with the collagen, the hydrolyzed collagen, and it took us 56 days of feeding the collagen to see any effect on the gastric ulcers. Well, you don't want to put a horse through 56 days of gastric ulcers hoping that the supplements are going to be working. So we want to treat them first, and then, you can put them on the supplements to maintain stomach health, but realizing that you might have to add treatment, pharmacologic treatment at a later time if the horse doesn't get better. So that's my soapbox.
Thanks, Frank. We have another question that's a little bit on the nutrition side. Does the type of hay fed affect ulcers? For instance, orchard, timothy, or alfalfa?
It can. There's some research out there which has shown that a certain amount of alfalfa can have a buffering effect. And as a result, that buffering effect can, again, reduce the predisposition for gastric ulcers, or hopefully if the horse is going to get gastric ulcers, it can hopefully reduce the severity of it. From a nutritional standpoint, I'm not a real fan of a diet that is 100% alfalfa for multiple reasons. But I think some alfalfa in the program works very well. In terms of looking at your grass haze, whether it's, Timothy, Orchard, Teff, Coastal, Bermuda, etc., there is so much variability within those different grass haze. In other words, there's more variability with different orchard grass haze than there is between orchard grass versus Timothy. So to make a blanket statement that, one of your grass haze is going to be better or worse in that regard, it is hard to make. Now, that said, Teff hay, for example, is recognized as being low in soluble carbohydrates, low in sugars and starches. So if we do have a horse that seems to be very predisposed to gastric upset or gastric ulcers, and you're trying to reduce those soluble carbs in the overall diet, then something like Teff hay is going to be more consistent in terms of having a low soluble carbohydrate level. Now, there are certain areas where Timothy hay is grown, for example, that just due to the area, the soil and the climate, that those hays will tend to be lower in soluble carbs compared to a Timothy grown in Ohio, for example. But you won't know that unless you actually have a laboratory analysis of that Timothy. So, but this is I think a point or a question that does bring up a valid point. And that is, if you're trying to reduce your soluble carbs in the diet, don't forget the hay, don't forget the forage, because some of your grass hays can actually be, up as much as, a little bit more than 20% in soluble carbs, and that's, fairly high. So
We've probably only got time for a couple more questions here, but I've got a treatment question just come in that I'd like to hand to Rana. What are the possible pitfalls, if any, of using omeprazole on a long-term basis rather than the initial 2 weeks to treat ulcers?
That's a good question. Generally, I would say, in my experience, depending on the case, I tend to have to treat for longer than 2 weeks in general to resolve ulcers. Particularly if I'm treating glandular ulcers, I find them quite challenging to treat. And so often, I'm using omeprazole for a prolonged period and adding other medications in, like misoprostol, sucralfate, trying other medications as well. Firstly, it's quite common to treat for longer than 2 weeks. And generally, I don't think that it does a lot of harm. However, there are certain situations where I'm a little more careful with my use of omeprazole. And the basis of this is that it essentially, the whole point of using it is that it increases the pH of the stomach. And so it decreases the acidic environment of the stomach. And in certain horses, or in particular our neonatal foals, in the neonates, for example, they do not have much else in the way of defense mechanisms against invasion of bacteria or other, potential disease. And so if you're taking away that acid, which is one of the only ways that they can fight infection, there is a possibility, and they've shown it in human neonates, that they have a higher incidence of circulating bacteremia or bacteria in the bloodstream that they have absorbed through their gastrointestinal tract because they don't have that acidic environment as a defense. For the majority of adult horses, they have a lot of other defense mechanisms in play, and so it's not a huge deal. But I would say, you know, potentially in some horses, if they are sick for other reasons, then I might be slightly more careful with it. Other than that, you know, I don't think there are some associations with possible in humans that they're coming out with possible adverse effects, but we haven't proven anything in horses yet. And so I will still use it as the mainstay of treatment for as long as necessary for gastric ulcers. I don't know if Dr. Andrews has anything to add.
I would second that. I think omeprazole for adult horses is pretty safe for long-term treatment. We like to treat them until the ulcers are healed and then put them on a preventative dose, which can either be 1 or 2 milligrams per kilo once daily. One of the things with foals and neonates, as Rana suggested, is there was a study done in a large number of foals in large clinics, and they did find about a 25% incidence of diarrhea in foals that were treated with really omeprazole and sucralfate, as well as H2 blockers like ranitidine. So I think whenever you alter that stomach flora, you know, and increase the pH, you can see gastric ulcers, or you can see diarrhea in these foals, especially in the youngsters. And some people have said that really the down neonate that's in the NICU or the neonatal ICU unit, really the pH in the stomach's high anyway, so the omeprazole doesn't really do a whole lot. So, but I think there's only maybe 10 to 15%, maybe about 14% diarrhea in foals that were not treated with the anti-ulcer medications, and 25% of those foals that were treated had diarrhea. So I think I'd stay away from, I try to stay away from a little bit more on the omeprazole and the neonates, especially when they're in the neonatal ICU unit. I used to treat everything. Now I'm I only treat the ones that are up and walking around and nursing on a regular basis, maybe that have some joint ill or something like that are painful. So it's a very good point, I think, Rana, that pretty safe, but maybe not in the neonates as safe.
Well, thank you guys, but that's about all the time we have for the questions portion of our seminar. Thank you very much, Doctors Andrews, Vandergrift, and Bozorgmanesh, and to Triple Crown, our sponsor. And we do have 3 registrants who will win a 1-year subscription to Off Track Thoroughbred magazine. They are Penny Prue, Kara Barker-Yellett, and Sharon Weaver. So thank you again to our experts, to our sponsor, Triple Crown, and for everyone who joined us tonight. I hope you have a good night.